Okay, so I'll give a little bit of introduction really quickly. We've got two speakers today from FACS. Myself, I'm Megan Canright. I am the Corporate Director of Scientific Operations, and I do a mixture of corporate and technical work. So I run our internal quality assurance quality control program, and then I also support technical projects in a variety of different practice areas: general industrial hygiene and exposure assessment, outbreak response, waterborne pathogens, et cetera. And then we also have Kristy Thornton on the call, who is a senior project manager in our San Diego office, and she also runs the local operations for the San Diego office as well. And Kristy and I have both been really heavily involved in our COVID-19 response for a variety of different clients. So we're really happy to be here today to share our perspective on what kind of returning to work looks like and what a safety plan looks like as buildings start to reoccupy. So I'm going to go over a brief introduction, and this introduction is going to be focused mainly on what we're talking about today, safety plans. We are not here to give an overview of COVID-19, the organism, or the disease. I'm sure you've heard a lot about that already. I know some of you may suffer from COVID fatigue, we call it, where you're just seeing a lot of information, absorbing a lot of information from a lot of different resources. So hopefully everyone is familiar with SARS-CoV-2, the organism, and COVID-19, the illness. So we won't be going over that today. We are just going to give a brief introduction into why safety plans are important. Then we're going to give, Kristy is going to give us an overview of building reoccupancy. So what should we be doing before we start to get people either back to work or back into our buildings and moving towards full occupancy or even modified occupancy? So what to do before to get your building sort of prepared. Then we're going to switch back to me, and I'm going to talk about our sort of key elements of a COVID-19 safety plan and sort of what you need to think about once the building is reoccupied and you start getting people sort of back into quote unquote normal operations or some semblance of normal operations. And then finally, we'll give you some resources that we think are really important regarding this topic that you'll find useful kind of moving forward and implementing this in your arena. So why do we need to have safety plans? First and foremost, I'm sure it's everybody's first priority to protect the health and safety of occupants in the buildings that we're managing and operating. So that's always our first priority. Certainly following any regulatory requirements. You've probably seen a lot of guidance documents out there. World Health Organization, Centers for Disease Control and even there's some federal guidelines that are out there for reopening. There also might be local or state specific requirements or OSHA requirements as well. So in California, we are going to focus, since we are California centric and we're here in San Diego, we're going to be talking a little bit about California in particular, and there are some state-specific requirements that we'll cover. But if you are in another state, there may be other, regulatory requirements that you should be aware of, and you're going to want to follow those regulatory requirements. Certainly legal concerns and liabilities. We want to make sure that we think about potential liability down the road, that we're thinking about legal concerns that might come up, and we're preparing and advancing in advance for those issues. Public perception and expectations. I'm sure you've seen that there are varying degrees of acceptable risk among the population. Some people are incredibly risk averse and maybe they don't want to go outside at all, and even if there are safe practices, they're just not ready or they're not willing to accept anything other than zero risk. And then there's the other side of the spectrum where people may be more willing to take on high risk situations. So what our purpose here today is to really give an overview of what's practical, feasible, and sort of in compliance with the guidelines and regulations that we're aware of. But you do want to think about that you might have varying degrees of public perception and expectations. And sometimes it might not be possible to please everyone. So it's important to have a reasonable program in place. Avoiding negative publicity and media attention, and this is always something that we want to be considering. We want to protect our brand and our reputation. And then last, it's just the responsible thing to do, especially given the state of affairs with the pandemic. So I mentioned we're going to talk a little bit about California. A lot of our documents and perceptions and perspective are based in California and of course other federal organization guidelines as well. But California specifically, this resilience roadmap webpage, which you'll find if you can just Google California coronavirus roadmap and it'll come right up. But this first stage requires the California reopening plan roadmap requires making sure that our workplaces are safe for our essential employees. So what does that mean? And what the guidelines say is essentially that a written worksite specific COVID-19 program needs to be in place at every office, every business, every building location. And that plan needs to be based in a comprehensive risk assessment that again is site specific and work specific, and that a designated person at each space needs to be designated to implement the plan. So this is really kind of what we're basing our programs and our recommendations off of, is not only California, but some of the other federal and other organization guidelines that are out there. So in a nutshell, we want to protect our people, protect our resources, and protect our reputation. And then in doing so, we want to make sure that our program is defensible, that it has elements that are based in sound science and the guidance and regulations and requirements that have been published. We want it to be practical. As I mentioned, we've seen programs that are, template programs that you download off the internet. We've also seen 180, 200-page programs that maybe nobody might have time to read. So what our purpose here is to really help you identify sort of what's practical, what works for your business, and you want to make sure that, or your building, and you want to make sure that it's feasible to implement. And then finally, flexible. As you know, things are changing on a day-to-day basis. Recommendations are changing from reputable organizations on a day-to-day basis. So it's really important to work that flexibility into your program as well. All right, I'm going to turn it over to Kristy.
All right.
And I might need to just advance for you, Kristy.
Okay, that's not a problem. All right, so we first wanted to discuss those building reoccupancy plans. Whether your building has been completely closed during this period or just certain aspects, certain community spaces have been closed, something that you need to reconsider. As the shelter-in-place orders are lifted, businesses are coming back online, people are returning to work, people are wanting to use those communal spaces and our open spaces a lot more. It's critical that we look at the building related issues and identify them and address them to ensure that we have continued health and safety of people as they reoccupy these spaces. The plans that we need to come up with do need to encompass a huge array of public health authorities. There's a lot of documentation out there from the World Health Organization, the US EPA, the Center for Disease Control and Prevention, the CDC, OSHA, Cal OSHA, even the American Industrial Hygiene Association has developed a range of documents that are quite useful as well. Now, when we're talking about our building reoccupancy plans, we want to start off with a building risk assessment. If you want to progress to the next one, Megan. Yep. And one of the easiest ways to do that is to just come up with a general checklist. Can be just looking at all the different aspects that you have in your building, looking at ventilation, your HVAC units, your building water systems, and those communal spaces. Do you have pools and spas or ice machines, vending machines? Just making sure that we're re-looking at all of those areas and checking that they're visually acceptable and that there's not any issues that are going to be present for tenants or occupants or even vendors when they come back into those locations. So that first part that I mentioned was the building records review. And that involves looking at things like your mechanical and your plumbing plans, making sure that everything's operating as it should have been. Maintenance records, has any maintenance occurred during this reduced occupancy period? Do you need to perform any prior to increasing your occupancy? Occupancy records, have people potentially left the building or left their locations for a period of time during this shutdown and they're now coming back. Things like that really affect how a building will be operating. Looking at both the potable and the recreational water systems. So do you need to flush any of the systems? What is the water temperature? Has anything been adjusted during this period? Potentially you reduced flow to one area of a building because of reduced occupancy there, or temperature or disinfection was adjusted as areas were not occupied for a period of time. Ice machines are definitely one to be aware of. Are they located in your building? Have they been maintained during this period of time? Is there a potential risk for anything, Legionella or any other waterborne pathogens to be developing in any of these systems at all, which is why we want to focus on just doing a quick, both a visual and a walkthrough inspection of all of our buildings for both these potable and recreational water supplies. Eye washers and safety showers, again, they're probably part of your regular checklist, but just ensuring that they are operating, that they're working as per their requirements, and that there's not any issues and they haven't been left untouched or unflushed for a period of time. And again, pools and spas, a majority of communal spaces have been closed during this period of time. Has the uptake of these areas been going? Have the pool and spa logs been maintained? Is this something that we need to review before we allow our occupants back into those communal spaces and to use those facilities that we have available for them? Yep. So another aspect on that risk assessment is the HVAC systems. Again, checking the performance. Do we need to flush the system at all? Potentially, again, because of low occupancy, we've reduced the performance of this ventilation system. We may not have been pushing air into certain areas of our buildings, just checking that it's operating as per its requirements, and that everything's up and running and operational before we reoccupy those spaces to their full capacity. Do we need to look at, increasing outdoor ventilation to increase potentially effective dilution ventilation in our buildings? Do we need to improve our central air filtration during this time? Is there a consideration for running your ventilation system 24/7 or for longer hours than you may have prior been running it for? If you have smaller communal spaces that tenants want to be using, is there a consideration for installing portable room cleaners in these areas where potentially social distancing isn't a feasible option? These are all things to consider in this risk assessment, looking at what our spaces are like, what controls we need to come up with, and what considerations we need to put in place before people reoccupy these areas of our buildings. And some of the other aspects to consider in that building risk assessment, which we may not have thought about, the focus is definitely on COVID-19 and what we're going to be doing about that. But some of those other things, because the buildings have been closed down, there's other environmental issues, mold and moisture. Has a closed building or location developed any issues? So we want to include that on our visual inspection and our walkthrough, ensuring that we don't have any issues with mold buildup or moisture. If we do, that we're rectifying that before we're allowing our tenants and our occupants back in those locations. Food safety is another one as well. You may have fridges in break rooms or communal spaces, even vending machines. Just checking the status of those, that there's nothing expired or out of date or anything that is potentially going to cause a food safety issue or even an odor issue. People tend to have vacated those areas and forgot about what they left in the fridge. So just including that in our initial risk assessment and our walkthrough is something to consider as well. And then just general odor issues. We have had a lot of areas or locations that have been closed up for upwards of a week, from just making sure that we're reopening them, we're checking for odor issues. If we identify an odor issue, we're able to locate where it came from. Obviously, if it's something that you aren't able to determine where it came from, seeking some third-party validity for an IEQ assessment or something of the sort may also be beneficial before you look at reopening those spaces to your tenants and your occupants. And that pest control, again, we have had a lot of areas closed up for this period of time, just making sure that that becomes part of our walkthrough and our assessment that we're doing, just to make sure areas are clean, they're functioning as they were supposed to be. There's no issues with water quality, mold, moisture, odor, pests, or anything of the sort. So it's all ready for when we reoccupy those locations. Now, in addition to that building risk assessment, that then leads us into these safe work practices. So we've identified any of our issues, we're able to then put together programs to amend those, and then that helps us with our safe work practices. It helps us look at cleaning and disinfection, what our general guidelines are going to be, what our focus areas are going to be for that cleaning and disinfection, how regularly we're going to be cleaning and disinfecting our common areas, our lobbies, elevators, waiting rooms, communal areas, and then obviously tenants and occupants can be responsible for procuring and cleaning their own personal spaces, but those communal areas or spaces that you as a property manager would be looking after, you'll identify those through your building risk assessment, and they can then form part of your safe work practices for cleaning and disinfection and more COVID-related responses. Now, when we're developing those safe work practices, we do need to consider the range of people that will be entering or utilising your property. You know, whether it's your tenants, your occupants, vendors, your own staff. There are a number of public health practices that you can use to help protect all of those parties and all of the people that will have access to your building. And that's something that we really need to consider when we're developing these safe work practices. Now, vendors are one of those parties, and they're definitely an outlier that we do need to focus on. Can be whether it's your electricians, your general maintenance team, your landscapers. Safe work practices need to include public health practices for these vendors that will be entering and exiting your property quite regularly. Whether you have requirements for them to attend the site, wearing a face covering or completing something as simple as a checklist to ensure that they don't have any of the signs or symptoms, but factoring that into who's accessing those spaces once they're reopened and how you're going to control access and people entering that space with symptoms, and also controlling the spread of any potential disease. So as I mentioned, something as simple as a screening assessment can be quite beneficial for even visitors or vendors in particular entering your buildings. You know, you've probably seen a variety of these around at the moment, but are you ill? Do you have a sore throat? Do you have a cough? Are you experiencing any symptoms? If no, please don't enter our property. If yes, if yes, please don't enter the property, seek medical treatment. If no, you can have access, but as per our safe work procedures and as per some of the requirements that we have in place for entering this property safely and working effectively together. And that probably moves us then into the COVID specific safety plan, which Megan will be covering.
Great, thanks, Kristy. So we want to give you a little bit more perspective on kind of what constitutes a COVID safety plan and what elements are really key to have as part of a safe work practices program. So first and foremost, there's the establishment of a COVID-19 safety team. There should be certainly elements of prevention. So how do we prevent contamination, of surfaces of our buildings? How do we prevent the spread of any potential illness within our building? So certainly the prevention piece is very key, but also the response piece is also very key. What do we do if we do have known or suspected contamination or a known or suspected case of illness, and how can we prepare for addressing that when it does come up? And then I'm sure you've all seen a variety of different programs and preventive plans in your line of work, but certainly there's training requirements, training not only staff, but certainly other types of occupants, visitors, staff, etc. Record keeping and supporting documents. So how are you going to document that you are following and implementing your program, and that you have the records to sort of back up and validate that those elements are being implemented at your given site? So we recommend establishing a COVID-19 safety team. The California requirements, as I showed earlier, just require a person to be designated to implement the program. That's an awful lot of responsibility on one person. So we recommend establishing a multidisciplinary team. You can have a core versus an extended team. So the core team might be, a subject matter expert, somebody that is familiar with public health and certainly COVID-19, has expertise in that risk assessment, and then someone who has organizational expertise, who really knows the building and the management and how the building is operated on a day-to-day basis. So that might be, comprise your core team. That core team is really going to be responsible for the overall implementation of your program. And then also, as I mentioned, things are changing on the day-to-day basis. So that core team might also be responsible for keeping up to date with the changes that are occurring, reviewing the guidelines and requirements that are made available, and keeping the program up to date and current. You might also have extended team members. So we recommend that these extended team members represent the various departments. You may have janitorial staff, you may have facility staff, members of management, members of legal, administrative. There may be various departments that are involved in running the day-to-day building operations. So there may be representatives from each of these departments, and these representatives would be responsible for disseminating information that is relevant to their departments in relation to implementation of the program. So they're going to enact the program provisions in their relevant areas of practice. And then, of course, provide feedback on implementation. Again, things are changing on a day-to-day basis, so we need that feedback from your extended team to make sure that the program is feasible, that it's being implemented. One of the worst things that we can do is just have a program that looks really nice on paper. Maybe it's in a nice binder on your shelf, but it's not actually being implemented in practice. We want to avoid that as much as possible. So your safety team as a whole, again, they're going to be monitoring public health guidance that is made available, both public health guideline documents and local state requirements that might have to be implemented per the area that your building might be in. They're going to be developing, reviewing, and updating your safe work practices as part of your program as needed over time. They're going to assist with the implementation of these safe work practices at the site-specific level. And then they also might be involved in performing training, and we'll talk a little bit more about training. So we're going to go back to this risk assessment, and we're going to talk about prevention as the first kind of key element that we want to focus on in developing our program. So Kristy talked a little bit about risk assessment as it related to building reopening. We also need to implement that risk assessment process when we're talking about safe work practices that need to be implemented when the building starts to become reoccupied and moving towards full or modified occupancy. So that's your safety team. Your COVID-19 safety team is going to be a key element of that risk assessment process. They're going to be the ones that are performing the risk assessment. We certainly recommend that your core team members include a subject matter expert, somebody that is familiar with public health and the risk assessment process, certainly someone who is familiar with COVID-19 and the risk factors associated with transmission and spread of illness, as well as contamination. So that person might be a site-based environmental health and safety representative, a corporate EH&S person, maybe a consultant, or really anybody, someone who has background training and education in public health and is familiar with COVID-19. We also certainly recommend that the building facilities manager or operations manager be involved in that core team risk assessment. That person is going to be the most knowledgeable regarding your building systems. And that risk assessment needs to be really focused on, it needs to be site specific. So as you can imagine, your risk assessment results, your program is going to vary based on the types of occupants that are present in your building, the construction of your building, the building systems that are operating, water systems, ventilation systems, et cetera. The workspaces and the equipment that's present in the building, and then certainly job tasks as well as the types of occupants that are going to be in your building. So a residential high-rise building is going to be very different from a commercial high-rise building, which might be very different from a hospital setting, which of course is going to be different from a manufacturing or an industrial setting. So really what we're saying here is that the same program cannot be applied to all of these different types of settings. And so that site-based, site-specific risk assessment is really key and the very first step in identifying the prevention measures that are going to be appropriate to your building type. You're also going to want to include a measure of physical distancing in your prevention portion of the plan. This is not always feasible, but you want to think about at least some physical distancing measures that can be implemented. Certainly allowing employees to work from home when possible or work remotely when possible. Again, that's not always possible. Certainly, at least in the beginning beginning stages of reopening, if there are non-essential in-person meetings that can be done by Zoom or be done remotely, that's always a good idea to keep continuing those practices even as we're reoccupying our buildings. Of course, continue to discourage non-essential travel. If people don't need to be moving in and out of their local area, that's always best in terms of protecting occupants that may be coming in and out of your building. And then if you can, and again, this is going to depend on the building layout, but maintaining distancing when occupants are present in the building. And so this is going to vary again based on your building type and the infrastructure that's set up within the building, but certainly something that needs to be considered as part of a program. Personal hygiene is something that you're going to want to consider as part of your prevention plan. Certainly providing guidance for your occupants about how to maintain personal hygiene. We've all heard this over and over, but it's in our human nature to touch our face, cough, sneeze, and not cover it. So just providing gentle reminders and guidance that's based in sound science, from CDC and other reputable organizations about hand hygiene, how often hands should be washed, how hands should be washed and for how long. Cough, sneeze hygiene. There are a lot of really good resources that are available from CDC that give posters on how hand hygiene and cough, sneeze hygiene should be performed. And then certainly reminding people to avoid touching their faces, noses, eyes, mouth, etc. And then another important thing to consider is how can people maintain their personal space in order to allow for cleaning and disinfection activities to occur. So maintaining their personal workspace, their personal area, wherever they might be, part of the building they might be inhabiting, minimizing clutter to allow for cleaning and disinfection, and maintaining clean surfaces to, again, avoid the number of materials that can be touched time and time again and help to spread contamination. You also want to think about what kind of requirements or what kind of recommendations you might make regarding personal protective equipment. So we've all heard this word PPE. Certainly there are lots of different types of PPE that have come up as part of this COVID-19 prevention issue. Surgical masks, respirators, cloth face coverings. Those are all things that can be worn over the face, nose, and mouth to protect inhalation, protect the face. Gloves protect hands and contact with different surfaces. Face shields might also provide a physical barrier between a person and potentially contaminated aerosol. So there's lots of different options that are available. Some things to consider when making recommendations or requirements is what can you actually require? So typically in an employment setting where you have an employee who is employed by your organization, you can make requirements for cloth face coverings, or even respirators. You can also make recommendations for gloves and other PPE, and those need to be worn as part of normal work practices. Those people who are your employees need to be trained, possibly fit tested, if they're going to be wearing an actual respirator in order to require the use of that protective equipment. It might be a little bit different with members of the public. You want to consider local public health mandates. There may be public health mandates for cloth face coverings when in public. You can certainly implement those local public health mandates. You also want to consider what you can require versus what is accessible. So if you are going to require, let's say, N95s for your work staff, you need to consider whether those N95s are actually available and in supply, because you would need to, as an employer, provide that PPE for your workers if you do require it. So just consider what is available. I know there's short supply of a lot of this type of equipment, so just something to consider. And you also need to make task-specific recommendations. So this will all be covered in your risk assessment. You'll be able to identify the highest risk tasks and that may dictate the use of personal protective equipment. Another aspect of prevention is going to be environmental disinfection and cleaning. So what you want to do is you want to have an established procedure. You certainly don't want cleaning and disinfection to be performed haphazardly. There should be a clear, established procedure for what types of cleaning products are used, how cleaning and disinfection is performed, and on what surfaces. So certainly determining what high-touch surfaces might need to be more readily cleaned. Things like keyboards, things like doorknobs, light switches, elevator buttons. Those things are going to be really high-touch surfaces that should be cleaned regularly, cleaned and disinfected regularly. The selection and procurement of cleaning products. The EPA has a really great list of registered disinfectants that are efficacious against coronavirus. So that is a good list to look at in terms of selecting your products. Again, you want to think about what is available and what you can procure, given that this is a pandemic and everyone is looking for the same cleaning products. You want to have a procedure in place for documenting your activities. So what cleaning protocols are being required, and are those cleaning protocols being verified and validated by your cleaning staff? And then you want to think about how you can validate cleaning. Certainly visual observation to make sure that the cleaning staff is trained and implementing the procedure correctly. There are also a variety of different sampling methods that you can utilize. There are limitations and of all of those sampling methods, and we can talk a little bit about that in some questions if you have specific questions of that. But you just want to be careful about what kind of sampling methods, and you want to understand the positives and negatives of each method that you might be implementing. And then finally, the last element of medical screening, and Kristy touched on this briefly, but you want to decide if you want to implement some kind of medical screening to allow folks to enter the building. Certainly encouraging people to stay home when they're sick. That's something that is what has been widely implemented. So we recommend that you continue to encourage people to stay home if they have any of the known of COVID-19. You can implement a health symptom questionnaire. You might also implement temperature screening. We do recommend that you use caution when implementing temperature screening. And the reason for that is that there is a large degree of variability in how temperature screening can be performed. So it's really important that if you do implement temperature screening at your facility, that there are established protocols, that those protocols meet the minimum requirements for the medical community, that you are using approved and calibrated thermometers and equipment, and that those equipment meet minimum accuracy standards. And that employees or people who are implementing temperature screening are trained in the protocol, and that they're documenting how they're implementing the protocol. So if you do consider medical screening as part of your Safe Work Practices program, those are just a couple of points to consider. So moving from prevention, and again, prevention is one of the most important elements. You want to implement safe work practices so that you can focus on prevention as much as possible. That said, as much as you prepare, you can always have an issue come up as well. And so you want to be also prepared to have a response protocol in place, such that if you do identify a known or suspected case of illness or known or suspected contamination, that your response team and you're ready to respond to that particular issue. So designating a response typically we recommend involves members of the COVID-19 safety team. You want to have an established protocol for how cases or contamination are identified, and this can be a little bit tricky. What is the protocol for identifying cases? Is it a known, established, diagnosed case of COVID-19, or is it just symptoms consistent with the illness? What do we do with people who have been identified as potential or suspected cases? Do we separate them once we've identified that they might be a suspected or known case? Do we isolate them from other people? How do we prevent additional exposure to people who don't have symptoms to that person who could possibly have symptoms? Do we perform contact tracing to try to identify where that person might have been in contact with other occupants or other surfaces within the building? And so we also need to consider, when we're thinking about case identification, separation and isolation issues, we need to consider the privacy of the occupant and visibility, potential visibility issues. So we want to be respectful of other occupants, and we also want to be respectful of the privacy of the person who might be exhibiting these symptoms. Then we want to establish what cleaning and disinfection protocols are implemented. So not only how do we identify what surfaces that person may have come in contact with, but what do we do? What cleaning and disinfection procedures above and beyond our normal cleaning and disinfection procedures do we need to do? Do we need to implement, and for how long? We also need to think about how those protocols are validated and documented, and if any monitoring needs to be performed. Again, sampling, any type of sampling or visual validation to ensure that those protocols are being implemented appropriately. And then of course having a program for following up with the team who did the response, the team who performed the cleaning and disinfection, and doing sort of an issue closeout or issue processing is always a good idea. Training and record keeping is always an important element of any program. You want to establish the training format. You know, in-class, in-person training might not be feasible right now given a physical distancing recommendation. So is it online? Is it on paper? Do you have people sign off that they've taken the training? What we can tell you is that training really should be site, job, and task specific. So if you're performing training for your employees or for your occupants, you need to think about very specific training elements that are going to be specific to those occupants or those workers for what they're going to be doing within your building. You're going to want to provide resources and ways for your trainees to be up to date and up to speed as resources continue to change over time. You want to document that training has been performed, and then you might want to verify and audit that your training is actually effective so that people are actually implementing what you've trained them to do. And then finally, record retention. You want to have a record retention policy. If you're maintaining physical cleaning and disinfection records, how often are you going, or how long are you going to retain those records, and who's going to be responsible for retaining those records is a good example. And then just finally, kind of closing up our safe work practices key elements, you might also want to consider what happens if your building might close again. So once you've reopened, you've got occupants back. If there is another potential flare in the outbreak or the pandemic situation that requires building closures, you know, what do you do now in a preventive way to help prepare for your building closure and also your reopening once you come back to work again? You also might want to think about your supply management. As I mentioned, some of these supplies, cleaning agents, PPE might be in short supply. If there's any other supplies that are critical to your business operation, you're going to want to think about how those supplies are going to be procured, distributed, and how inventory is going to be kept and maintained. So that covers the key elements, and what I'd like to do now is just kind of show you a couple of examples of what we've seen these programs look like. So things that we think that need to be considered when developing the safety plan, I'm just going to touch on this again. Your safety plan should meet local, state, and federal guidelines and requirements as they are available. You do want to have a clear written plan that states the requirements. So this written plan might be a document that is comprehensive, addresses all of those key elements that we've identified for you, and is site-specific in nature. And that might be something that is owned and operated and maintained by your safety team. You want that program to commit to elements that are feasible to implement, and that it's flexible so that you can adjust those elements if they're not shown to be feasible over time. But that written plan might not be the best thing to share with all of your building occupants. You may be providing them with more concise or information that is specific to their particular role within your building. So that concise and effective communication of the program elements to end users is really important as well. So one example of a, so in San Diego, the city of San Diego has released a safe reopening plan as an example of what might be required to open a business or a building. So while there are some really good guidance elements within this document, it's 3 pages and there's a lot of blank spots in there, right? It's a lot of, it's a little bit of guidance at the top. It guides you through some kind of checklists. But then there are sort of these wide blank spaces where it requires the building owner and manager to sort of free write what are they going to be due to protect their.
I'm on a webinar.
So this might not be something that's really comprehensive and you know, useful for you to implement at your site. What we recommend is having a written safety plan. So again, you might have a longer document, a more comprehensive document. The safety plans that we've written for our kind of variety of clients range from 5 to 15 pages. They might be fairly comprehensive, depending on the specific building or business that we might be writing them for. We tend to take a tiered approach. You might have global practices that might be relevant to employees, visitors, or vendors. You might have different practices that are for common environments like offices, elevator lobbies, entry lobbies, restrooms, classrooms, conference spaces, communal areas, etc. And then you might also have different work practices for other specific areas, maintenance or custodial areas, facilities areas, shops or studios, food service areas. So you might be implementing different work practices for each of these different types of areas in your building. So what we recommend in our approach is to, we found that kind of coded mapping is a really great way to demonstrate the requirements in a quick and easy way to a variety of different occupants. So we, this is an example of kind of what we've implemented here. You've got your building floor plan, and then you have your legend, which is going to show you what specific requirements are required by area and by color code. So these are really great to post in, you know, accessible areas of your building. And then those color-coded areas are linked to specific practices, which can also be posted and can also be shared with individuals and individual occupants within your building. So we found this is a really quick and easy way and a really effective and feasible way to communicate what's in your more comprehensive plan to the end users. So that's kind of our perspective on building reoccupancy plans and safe work practices plans as they relate to COVID-19. We'll take questions in a minute here, but just wanted to provide you with some really useful and reputable resources. There's a lot of information that is available online. So you want to make sure that the resources that you are relying on are peer reviewed or released by reputable organizations. So certainly the California Resilience Roadmap, we have Cal OSHA guidance for workers, and then Centers for Disease Control and World Health Organization also have really comprehensive guidance out there, really comprehensive web pages. And then you also might find some local guidance useful. San Diego County, LA County has got some great guidance, San Francisco, and then New York also has some really good comprehensive guidance available to you. So with that, I want to just post our contact information. You're welcome to contact us with questions. And I think we've got about 10 minutes left if there are any questions that we can answer right now.
Yes, hi, this is Nicole, and I am monitoring the chat box. So if you have any questions, those in attendance, please use the chat box and I will ask the question of the speakers. The first one is ask about the importance of getting a vendor that has had their employees properly tested and trained for don and doffing their PPEs.
That's a great question. So you've seen people wear a variety of different PPE. I'm sure you've seen people wearing gloves in the grocery store, and maybe they're touching something in the grocery store and then they're touching their face with their gloved hand. PPE itself can become contaminated as it's being used. And so it's really critical that when you are requiring PPE to be worn, either by your employees or by vendors, that those people are trained in how to properly use, how to properly put on and take off, and how to properly store and clean that PPE. So there are specific ways that PPE can be taken off. There's glove removal guidelines, there's respirator and face covering removal guidelines. I can't show you that today, but those are available from CDC and other organizations like World Health Organization. You can look up on videos from CDC and World Health Organization that show the proper ways to take on and put on that PPE. So we certainly recommend that that be required of vendors as well as workers if you have employees that you're requiring to wear PPE.
Okay, thank you. The other question is, can we get a copy of the plan highlighting the checklist that the safety team should oversee? We are recording this and sending a copy to everyone, but is this something different?
So we do have, if you go to our website, we do have a blog. So it's at here's our website, forensicanalytical.com. So we do have some example documents in one of our blog posts. I believe it was the most recent one, but it's the one on safe work practices. So there are some examples of some kind of example documents that you can look at as part of that post.
Okay, thank you. Next question is, if you're the requirement of masks in the workplace. If you're seeing the same employees daily, do you see the masks being required to be worn?
So it kind of depends on what the state of affairs is in your local area. You know, cloth face coverings may be required in public when, you know, physical distancing is not, you know, being implemented. So we do see that most building operators and managers and most employees are requiring some kind of at least cloth face covering when physical distancing is not feasible. So what does that mean? So typically they're requiring some kind of cloth face covering coming into the building when people are in common areas. But as soon as they get to maybe their personal desk space or their personal suite or their personal area, they can take that cloth face covering off. They do need to don it back on once they're going back into a common area or they're expected to be interacting with someone where that physical distancing of 6 feet or more cannot be maintained. That said, it's going to, whether you can require that or not, may differ based on your local jurisdiction.
Okay, the next question is, how do you vet the vendors used? And then another question kind of goes along with that. What are the dangers of having a vendor that just does janitorial normally, doing it if they are not certified?
Okay, let me make sure I understand the question. So first and foremost, how do you vet a vendor coming into the building? There's lots of ways that you can do that. One of our recommendations is that you ask them what kind of safe work practices they're implementing. So they should be required, you might require them to show a copy of their safe work practices program or give you a physical description or a verbal description of what kind of practices they're implementing, you know, before, during, and after they come onto your site. So that is definitely something that we recommend asking them. So doing an initial interview before they come on site. That's also a great opportunity to compare their safe work practices to what your program requires and to make changes or ask them to make changes for when they're performing work at your particular building. In terms of what are the dangers of not using a certified vendor, I'm not aware of any certifications related to COVID-19 specifically. You may be talking or referring to things like the IIRC certification, so training that those vendors may have been involved with. It's always a great idea to ask for background training and experience. So whatever your building operation may be, I would certainly ask your vendors if they've had experience in that venue. So a hospital, for example, I wouldn't want to bring in someone who never had experience with hospitals in to perform cleaning and disinfection in a hospital. I certainly would look at their protocols and their cleaning protocols and disinfection protocols to make sure that they're using EPA registered disinfectants and that they have clearly stated protocols and that they can show that those protocols are efficacious. I hope that answered the question.
Those are the only questions I have so far. Are there any other questions that anyone wants to send in the chat box?
Kristy, did you have anything to add that I might have missed in answering those questions?
No, I think, yeah, just the one about the vendors and the cleaning, just on top of what you said, if you have internally a work practice where you're validating those cleaning, you know, the amount of time that the disinfectant is wet on the surface and validating what the vendor has said that they're going to do as part of their cleaning and disinfection protocol, then that's an extra tick in a box to kind of validate that protocol and ensure that you're getting the most out of those vendors when they're performing cleaning and disinfection.
Great points. And speaking of validation, I did touch briefly on sampling and sampling as part of validation. You may have come across a variety of different sampling methods that vendors may be offering or reviewing as part of their cleaning and disinfection protocols. Some examples would be ATP monitoring, which is adenosine triphosphate. They also might be taking COVID-specific samples, swab samples or bulk samples, and submitting those to a laboratory. There are also other fluorescent type equipment that are available that can look for agents like bacteria or mold that might not necessarily be the virus, but may be indicators of a generally clean surface. So our recommendations there are that whatever validation sampling is being proposed, that you understand and that your vendor understands the pros and cons and certainly the limitations of those sampling methods. For example, ATP is commonly used in healthcare settings to assess cleanliness, but viruses, and ATP is released by all living organisms, but viruses are not living organisms and they do not generate ATP. So it's certainly not an indicator of the presence of viral particles. It may be indicative of the presence of other indicator or surrogate organisms and the cleanliness related to those organisms. So that's just an example, but certainly use caution when implementing sampling protocols and make sure you or your vendors or whoever's implementing them are aware of the limitations.
Thank you. I don't have any other questions. I guess we'll turn it over to Lucinda to finish up the call.
Thank you so much.
Megan and Kristy, thank you so much for hosting and sharing with us this really incredible information today. I know everybody has found great value in what you've had to share. I look forward to receiving this by email from IREM San Diego, so that I can take a look at it again. Thank you for telling us about the FACS.com, is that correct?
It's forensicanalytical.com, but
got it.
Close.
A blog where you've got some recommended resources, and I think that that's really, really great information. Thank you everybody for attending. Please don't forget to complete the eval form and send it back to us so that we know how it goes. And please, 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 if you're interested in a June 4th presentation, please log on and register. There are not very many spots left. So thanks again, everybody. Have a great day. See you next time.
Thank you.